Good morning, everyone. This is Boaz Arzi here. I want to show you what we've done with the new facility of the dentistry and oral surgery. The new place is inspired by similar offices in the human medical world. We actually used the same machines, the same concept that we had in the previous dental operatory with the company ADAC, except that now, 30 plus years later, this is the facility we envisioned moving forward. Welcome to the Meadowview Foundation Dental and Oral Surgical Center. So the new center have three separate operatories or bays, and each operatory is a standalone. So a typical operatory has a table that you can recognize similar to what we had in the previous operatory, where everything goes here and is a round shape, and the same height, the same concept like we had before. It was very successful. We have our lights. These are all ADAC lights, all getting turned on without a touch. Unlike the previous place where we had the anesthesia in the wall, anesthesia machine is present now in each operatory with its own setup. We have the bear huggers that are connected to the wall in each operatory, and that is the setup for the patient. The assistant have full control into suction and use 3-in-1 air-water syringe that it moves with the operator. And then we have the surgeon part that is digital, and one can select what you're going to be using. And then once we obtain radiographs, we have everything here, everything that we need to see right there. The computer here can be used for records. The computer can be used for imaging. We have the anatomage system here. We have the metron system here. So the operator don't need to leave the room to look at the imaging throughout the procedure. So each room can get radiograph from two different sources. We have the radiograph unit here, so both arms can get into each table. We can also do rounds with the students in the operatory. Surgical sets sit here and also sit here. So the surgeon don't need to move too much, it moves to them. When we obtain radiography can start from here. That's where we obtain radiograph by pushing on these buttons. That's where we process those. Everything else is all set up here. Each different bay operates separately. As you can see here, already charting after taking full mouth radiographs. The radiographs are already on, then allow us for quick charting. Hand washing stations, just like here, hands-free. Everything is hands-free. Same thing, this is the third bay, and having charting right now, radiographs are already on. We also have office for the team, where the residents, faculty and staff have a place to sit, computers for work. We also have a coffee station.
Here's our new and improved sterilization center. So it's very similar to the old room, but it has more space and is separate from the operatory area. We go left to right, so in the same concept of dirty to clean. We process the instruments here. We still have our handpiece oil system. We have an instrument washer here that replaced the old ultrasonic system. So once they get cleaned in this, we then process the instruments and wrap them here. They then get sterilized in our autoclave, which is what we had before, but we also now have a Statum, which is a sterilizer that can sterilize instruments in about 5 to 10 minutes. And then once they come out of the autoclave, they go into the clean storage area, and then they get distributed throughout the operatories.
We also brought the legacy from the previous room to this room. There's Dr. Vestrate here, and all the previous residents, or the Wall of Fame right there. The new Dental and Oral Surgery Center, known as the Meadowview Foundation Dental and Oral Surgery Center, was made completely with donors' funding, from start to finish. And so we had the Meadowview Foundation sponsoring most of it. We also had either private people or foundations, but in general, everything here was made possible by donation. So the team is now here working with high energy, high efficiency as always. And thank you for seeing it, and reach out if you have any questions.